Hi there, my name is Jamie Rose and I'm a board certified behavior analyst or a BCBA with EICS. ABA is an evidence-based practice based on the science of learning and behavior. The science includes general laws about how behavior works and how learning takes place. We apply our science to increase useful or desirable behaviors while decreasing problem or unwanted behaviors. There are 4 functions of behavior, that is, 4 reasons why people do what they do. 1 is gaining attention from another individual. The next is escaping something that's not preferred. The third is gaining access to something. And the last is automatic reinforcement. So that means something that's intrinsically reinforcing without another individual present. A good example of that would be singing in the shower when you know nobody else is home. Many of our clients begin ABA services with problem behaviors. Some examples of those are physical aggression, property destruction, or non-compliance. When addressing problem behavior, we begin by collecting data on the behavior, analyzing the data, and evaluating what need or want the client is getting met by engaging in that behavior. Once we understand the why of why the child is engaging in the behavior, we introduce a behavior plan to teach the individual to get that want or need met in a more functional or socially appropriate manner. Functional communication training, or FCT, is one method that we use to teach and establish replacement behaviors for inappropriate behaviors. This is a procedure that many parents use without realizing it. For example, if a child has a behavioral history of screaming when his sister has a turn with the TV remote, and then accesses the remote following him screaming, we may hypothesize that he engages in screaming to gain access to the remote. Our behavior intervention plan may be to prompt the child to say "remote" as soon as the remote is removed from his hand, and then returning the remote to him immediately following him functionally asking for it. That way he learns when he says remote, he gets his need met immediately. At the same time, we would teach him that when he screams, he does not gain access to the remote until he uses his words to say remote. This will remove the value of screaming because it's no longer helping him get what he wants. When we first introduce something like this, we want to give the child what is requested every time he or she asks to reiterate the value of using words. Once a child is consistently using functional communication instead of engaging in the problem behavior, in this example, asking for the remote instead of screaming, we introduce waiting following communication. This teaching methodology can be used with individuals of all communication abilities. We want to teach a replacement behavior that is the least effort for the client. This increases the likelihood that the child will attempt to communicate functionally rather than engaging in the problem behavior. For example, if a child has limited or no vocal communication, we may teach the child to point to get his want or need met, or we may teach them to exchange a picture. If a child can say multiple words, we may still only teach the child to say one word instead of engaging in the problem behavior. For example, we might teach the child to say remote instead of "I want the remote please," because it takes less effort to say remote, which competes with the problem behavior. In the upcoming clip, you'll see an RBT working with a client on requesting gummy bears. We're going to pretend that the child has a history of taking peers' gummy bears without permission. Our program is then to teach the child that it's more effective to say bear than to take the gummy bear without permission. At this phase of the intervention, we are honoring each time he requests and denying access to the gummy bears when he tries to take without permission and prompting him to say bear. This is teaching that verbally requesting gets him access to the gummy bears quicker than if he takes without asking. Again, this is a made-up scenario just for the sake of demonstration.
Say bear. Good job. Way to say bear, man.
Note that the RBT blocks access to the gummy bear when the client attempts to take without asking and immediately prompts bear. As soon as the client says bear, the RBT provides a neutral comment on the behavior, saying something like, "That's asking for bear," and giving half a piece.
Way to go, that's saying bear.
When the client independently asks for the gummy bear, the RBT gives a whole piece and provides higher magnitude behavior-specific praise, such as, "Way to go, that's asking for a gummy bear." We're teaching the client that it's more advantageous for him to ask for the gummy bear the first time on his own and less valuable to reach for the gummy bear without permission. Thanks for taking a moment to learn a little bit more about procedures that we use in ABA.